In this video, we're going to cover what is plantar fasciitis, what are the general things that can cause it, a little bit about the structures and anatomy that are related to it, and how massage therapy can help it and resolve it for you. So let's get to it. So, I'm going to be bringing in some stuff from a webinar I taught to massage therapists about this. I'm not going to be showing treatment stuff for that because that's part of a course that I teach. But I do want to cover the general stuff for you, the public, on what it is and how it works. And, you know, I've actually had it as a person. It's not very fun. So let's start with what it is and what generally causes it. So we've got this fun top-down camera. So I want to outline what is the plantar fascia. So it is this sheet of fascia, and fascia are these sheets of glue in the body, and they can show up as very thin, papery sheets or very thick, dense sheets. Your IT band is an example of something that is a very dense sheet of fascia, and fascia is basically made of collagen fibrils and water that are packed together in the body to glue tissues together. They're non-living and they are throughout the body, right? And so the plantar fascia isn't like the IT band in that it is a pretty dense structure that is meant to be pretty tense and not very stretchy. It's meant to be very supportive for the foot and the arch. Yeah, it's meant to be a support structure for the foot that doesn't have a lot of give or stretch to it. And you can see in this image here how it basically attaches to the very front of your heel bone or the calcaneus and the very front of your, what are called the met heads of your feet, which are the front of the metatarsals, which are the long bones of your toes before we get to the phalanges, which are the toe bones. So these bumps right here, which we think of as the triangles of your foot, those are where this long plantar fascia attaches. Now in this image you really just see one layer of it. In reality there's actually 3 layers that get shorter and shorter stacked in the foot, but we'll get to that later. But basically you can think of this as sort of holding the arch shape and keeping it strong, right? Because without that the bones would just collapse and never form an arch at all. Okay, another word for that would be aponeurosis, and that's just a technical Latin term for a dense sheet of fascia. You have something called the lumbar aponeurosis in your low back, which is just another area of dense fascia, just to give you an idea of where that might show up in the body. Okay, here's a bottom-up view of what it might look like. So you can see it's not just a flat sheet that is just a flat sheet with no differentiation, that it's actually got some differentiation to it. And your version of this would be completely unique to mine. It wouldn't necessarily look exactly like this. It could be different on different people. And you can see on this image how it might have some give to it. It's not a purely unflexing structure, but it shouldn't have a lot of flexion to it. When you flex your toes, it's going to have some ability to stretch, but it shouldn't be super duper stretchy. And again, how it basically connects the front of your heel bone to what are called the met heads, and that it also kind of comes up through the front of your, the very front of your toes as well. Now, in this, you can also see how there's multiple layers to it. There's something called the lateral plantar fascia over on the outside edge of your foot, as well as the middle of the foot. Okay, now specifically, this is designed to hold the arch shape such that the arch has the ability to compress and then pop back up when you take weight off of the foot. It's like a coiled spring. It's supposed to provide energy so that when you take a step, it compresses and then gives some spring to your step, literally, so that you have some forward momentum and you get to propel yourself forward. Okay. Now, it looks like we just have one arch, but in reality, we have 3 arches, just to give you an idea. And I'm using the word arch, that's different than talking about the plantar fascia. Traditionally, we talk about the inner arch of the foot. In reality, there's an inner arch, an outer arch, and then a transverse arch across. If this were the foot, here's the inner arch, here's the outer arch, and across the toe heads, the met heads, you have this transverse arch. And you can see here, there's inner arch or medial, which means inner, lateral arch, and then transverse. And I'll blow that up here so you can see it. Medial arch, lateral arch, transverse arch. Okay. Now, in a healthy foot, the plantar fascia can really take steps forever. Your heart and lungs might not be able to because you need to sleep eventually. But you should be able to walk all day long without injuring your plantar fascia. That would mean that your ankle functions properly and that your toes function properly. And if those things are functioning without issue, your plantar fascia can do this thing where it stretches and releases all day long without having any injury at all. And it would be able to do that for your entire life, theoretically. However, if those other things, your ankle joint, what's called the subtalar joint, or your ability of your foot to invert and evert, and your toes, all of them, but especially the big toe joint's ability to track through the walking, if those have dysfunction in some reason, then the plantar fascia may be overstretched in the walking, and that may start to cause little tiny micro tears in it, which at first might not feel like anything at all and might be fine. And then at the end of the day, you go to sleep, they heal, no problem at all, Bob's your uncle, everything's fine. The next day you get up, they rip back open again, you walk, everything's fine, you don't feel anything. However, if those ankle joints or subtalar joints or big toe joints are continuing to not function properly, and you're continuing to overstretch the plantar fascia as you walk, and you're taking your 7,000, 10,000, 20,000 steps a day, you're continuing to cause these little micro tears in the plantar fascia throughout the day. You go to bed, they heal, but your calf is getting really tight, and instead of healing in this nice position, your foot starts to heal in a pointed position. You wake up in the morning, you take a step, all of those little micro tears rip back open again. You start walking, everything feels fine, nothing happens. You start doing this every day, everything starts getting a little more torn, a little built up. Eventually you start getting pain, and it gets worse and worse and worse until you start getting a real buildup of pain. Now, that can show up in several places. That usually can show up at the heel attachment, but for a lot of people it can show up at the toe attachment, and for some people it shows up in the middle of the plantar fascia. Now, that has some problems, right? So a few things going on here. One, the plantar fascia is not living tissue. It is not skin or muscle tissue, which has blood vessels in it, which would be much easier for your body to heal. If you have blood vessels in tissue, your body has a much easier time taking out torn up stuff and bringing in healthy stuff and repairing it. It's very simple. It just brings in a repair crew, changes everything up, and it's a very quick process, or usually, unless it's very damaged. However, if it is like a tendon or a ligament, which doesn't have a lot of blood vessels in it, or a fascial aponeurosis, like a plantar fascia or the IT band, there aren't very many blood vessels at all, or any. And therefore, it basically has to do this funny thing of bringing the things it needs to repair it nearby and throwing the stuff at it and hoping that it works. It sort of brings fresh, collagen fibers and water as close as it can to the thing, and sort of shot puts it over there and goes, please try to repair yourself. And then it hopes that it seeps the bad stuff out of there and like, please give me your bad stuff so I can take it away, which takes forever. And that's why it's a real pain in the foot. I was about to say ass, but foot, to heal this stuff, right? And so you have to be really, change the way that you think about trying to heal an injury like this. It's not like a torn muscle. You're not gonna just walk it off. In fact, that's the worst way to think about it, because it is just not gonna heal quickly. And in fact, you really have to know how to strategize the right way to recover from this kind of an injury. And so I want to give you some tools for that. So one, let's get into the why. So again, micro tears that tear up, then you walk all day, and then they heal at night, only to have you re-tear them really quickly in the morning taking your first steps. So strategy number one, prevent them from healing in the wrong position at night. So they actually sell braces that you can get very cheaply on Amazon that will hold your foot at a right angle while you sleep, assuming you can sleep with your foot in that position. Most people can. And they literally are a brace with a strap that will pull your foot into a right angle, meaning that when you wake up in the morning and take your first steps, you're not gonna have to go like this and tear all that tissue back open. Meaning it's much less likely that having healed all the tissue all night long, you're then gonna rip it back open taking your first steps. So that's strategy number one. It's silly how cheap those braces are and how much they will help you, but absolutely go get them. It's worth every penny of the, $15 they cost. It won't magically heal you in one night, but probably in a week, you'll really turn a major, 80 to 90% of the way around the corner. So that's strategy number one. Okay, so the second strategy that you can employ after the brace is to use kinesio tape. And so you can start with just a pre-made kit they sell in packages, or just get a roll of it yourself and look on YouTube to see how to use it. My advice would be to get the pre-made kits, but if you want to save some money, you can start with the roll. The pre-made kits basically come with 2 strips, and you can just follow the instructions. Usually what they will do is have you do a wrap around the midfoot, and then one long piece from the bottom of your foot up the calf. And basically what they do is they provide a little bit of extra support for the plantar fascia itself coming up along the calf, such that your plantar fascia doesn't get as much stretch to it and will prevent as much pull on it. It's almost like having a little bit of a heel raise without actually having to wear a shoe with a heel raise in it. Having had plantar fascia myself, I will say I literally went into Walgreens in Florida when I got plantar fasciitis, bought one of these kits for 20 bucks, slapped this tape on, followed the instructions, and my plantar fasciitis went away in 3 days. So it's totally worth it. It's really great. It's not going to solve all of your problems for those of you who have the problems, but for a lot of you, it might. So again, between those 2 tools, for a lot of you out there, it's going to work out. It's not going to solve it all, and it certainly won't say that you should only do those things and it's going to magically solve everything. You absolutely should learn some stretches. You might need some body work. You might definitely want to work with a physical therapist as well, because there may be other issues that would help resolve this in the long term. But for quick relief, those are going to work pretty well. Okay, so a couple things now, going back to just like what it is and how it works. In general, people who have flatter feet and fallen arches are the ones who are going to get plantar fasciitis. People with high arches are far more likely to get shin splints. However, that is not a hard and fast rule. I've seen it go the opposite in multiple cases. But in general, that is how that goes. Okay, so some causes, right? Because you may be wondering, like, why did I get plantar fasciitis and my friend didn't, right? Or why is my case of flat feet leading to plantar fasciitis and my friend with flat feet not leading to all right, so here are some things that can make your flat feet also then lead to plantar fasciitis. So if you have a job that is walking on concrete, hardwood all day, or tile floors that have concrete underneath, like for instance, if you're a nurse working in a hospital scenario, that and walking 20,000 steps a day, 12-hour shifts, yeah, that's definitely a major factor that could lead to plantar fasciitis for sure. Or I have a client who works in a warehouse, whose job involves walking the entire warehouse every single day, 5 days a week, 6 days a week sometimes, and 20,000 to 25,000 steps every day he works. That's a highly likely scenario to lead to plantar fasciitis, in which case you really got to invest in the right shoes. You've got to learn some really good stretches for this, and you want to make sure every night to wear those braces. You really got to think ahead that I'm the person who's probably going to get plantar fasciitis, so let me do some preventative work ahead of the game. Shoes that are either too small in length or too small in width are definitely factors. Stiff dress shoes or stiff bottom shoes, high heels, cleats. Soccer players definitely are going to potentially, baseball players. Walking in bare feet at home a lot, or if you've got a job, I had a job as a lifeguard and I walked around on concrete pools all the time. That probably was the beginnings of mine, even if it was 20 years ago. But who knows, lots of other things could have led to it for me. High impact activities that involve a lot of repetitive landing on your feet. Gymnasts, hello, hi. Walking or running long distances. Those of you who are into the barefoot running movement, if you did not grow up walking and running barefoot your whole life and you've been wearing dress shoes in an office your whole life and are now like hot to trot on barefoot running, if you don't spend a year or two slowly training yourself to walk barefoot and then slowly training yourself to run, walk barefoot and run, walk barefoot, and really slowly change over to that, you could easily give yourself plantar fasciitis, if not lead yourself to multiple stress fractures in your feet very quickly. Some other factors that might contribute to getting plantar fasciitis are if you are genetically hypermobile. That means that the bones in your feet could easily be much more mobile. The ligaments could be a lot looser, and the plantar fascia itself could be looser. And that would make it much more prone to overstretching and getting those little micro tears in it. That would mean that in order to prevent that from happening, you're definitely going to want to do some strength training and some stability and balance training. That's going to help protect that. Autoimmune disorders, hello, psoriatic arthritis, which I have, which probably was why I got plantar fasciitis in the first place. MS, I have a friend, Byron, who also has had plantar fasciitis before, which probably isn't directly from the MS, but is from his drop foot from the MS, which then creates an inability of the ankle to move properly, which then overstretches the plantar fascia, so that can show up. Also, anybody with drop foot from, let's say, a stroke might develop plantar fasciitis as well. And that's the next bullet on here. So strokes or other forms of neuropathy where the foot doesn't continue to roll properly, which then will cause that plantar fascia to be overburdened and not have the ankle roll properly, which then overstretches the plantar fascia every step, can lead to it. And then I've had probably several dozen clients in my career who are genetically missing or have extra bones in their feet, which is not as rare as you think it might be. And they will probably benefit from working with a podiatrist to get orthotics custom made for them to support them, because they just don't have the same shape to their foot and same arches as we do. Okay, so it is absolutely possible to relieve plantar fasciitis in the long term, but not by ignoring it. You definitely want to take a break from normal activities, because if you just keep doing things the normal way, you're going to keep ripping the tissue up, and then it's going to keep healing overnight in that position, and then keep ripping back open every day when you wake up and put pressure on it again. So I would highly recommend stopping running, stopping working out for the first week to 2 weeks, really learning some basic stretches, such as learning how to stretch and self-release your tibialis posterior, which I won't show in this video, but you may see in other videos we have, and certainly will learn in the plantar fasciitis webinar that we have on our website. And then some of the strategies that I talked about earlier, if you start to employ those, you should be able to get back to normal activities relatively quickly, especially if you start working with a body worker like our team and or a physical therapist. As soon as you can do normal activities within a few weeks without pain, you should be able to build back up to normal activities within 3 to 4 weeks. And then you can cycle out some of these extra things like the braces or the kinesio tape slowly but surely. And I was able to resolve my own plantar fasciitis and stop using those things within around 3 weeks or so. I still, every once in a while, get little flare-ups, partly from my psoriatic arthritis, my autoimmunity. But I also know exactly what I need to do to get it to stop and sort of tamp it down. So just know that it is the kind of thing that can flare up and back down again from time to time. All right, so we talked about bracing. Bracing can help, and the good thing about those is just, throw them in a drawer and have them at hand if you ever need them again. Don't throw them out, because it can flare up again. Okay, again, with a combination of knowing how to reduce your activities, know the right stretches, know how to take care of it. Contrast bathing is another way that can really help it. So 5 minutes of hot, 1 minute of cold, 5 hot, 1 cold, 5 hot, 1 cold. That can be a really helpful way to sort of get the tissue to push blood back and forth around it and get the healing to speed up. Compression can really help out a lot as well. There's a lot of new fangled devices, like the Therabody makes these compression boots called the TheraBoots Prime. They're not cheap, but they are helpful. They're not designed specifically for plantar fasciitis. They're more of a whole leg thing, but they could easily help speed up the process indirectly. They're not the first thing I would recommend, though. The braces and the cheaper things would absolutely be the first thing I would recommend. Okay, so the rest of this stuff on my webinar is much more for the body workers and the LMTs, and That I'm going to save for the online webinar that we teach. And so if you're interested in that, check out a link in the website and go to our website and check that out below. In any case, if you have questions or if you're dealing with this yourself and some of these strategies are helping but they're not fully letting you get out of pain, by all means, and you're anywhere near New York City and want to come in, our team can help you. This is something we deal with all the time, and it's not something that should take forever to resolve. These sorts of strategies with a few targeted bodywork sessions should be enough to get you out of the cycle and back into your activities. So if you want to check that out, we'd love to work with you, and hopefully we get a chance to work together. So check out links below and have a great day.